Well, good morning and welcome to our Day 7 live of the GMP feature that we're hosting through Natural Health Regulatory. Today we are going to carry on with our discussion on personnel. I know we talked a lot about personnel yesterday, but it is quite a large part of your good manufacturing practices, which I was explaining yesterday. The core of your business is the people that work within it. They actually make that organization what it is. So today we're really going to focus down on one role in particular because it's a huge role to fill, and that is the role of the quality assurance person. So in order for somebody to be qualified as a quality assurance person in terms of what is required on your GMP manual that you submit to Health Canada, you can provide them with a QAP resume. QAP, stands for Quality Assurance Purpose or Person. I'll probably use QAP a lot because the rest of it's a mouthful. So, your qualifications of a QAP in terms of your evidence that you provide to Health Canada can be things like a QAP resume, an educational degree, a technical degree or diploma. It can also be, if we're talking smaller companies that are, a solopreneur or that are a small business where you're really limited in terms of the number of personnel you have, you can supply them with your personal resume, your training, any certification programs you're currently enrolled in, the professional associations that you are associated with. And just to talk a little bit about the job description itself, the QAP person is the person who approves finished product and all specifications. They are the ones who produce the master production documents and the batch records. They are the ones who review and approve certificates of analysis. They are the ones who actually do a record for it's an OOS, so that is out of specification. So if you receive raw materials in and something is wrong with it, the seal is broken, it's ripped, it doesn't look, smell, feel right, that is considered out of spec and you have to record that. Raw material release records. So when you receive an order in and you're going through that order piece by piece according to the lading, you'll review each product individually. And then the quality assurance person will release it. They'll sign off saying it's approved, it's declined, or it's placed in quarantine while they sort through whether it should be approved or declined. As well, we talk about product complaints and investigation reports and corrective actions. So if there is a product complaint from a customer, it is the QAP who is responsible for that. They're responsible for investigating that complaint and providing a report on it. They're also the person responsible for coming up with a corrective action plan for that product complaint. They are responsible for maintaining all relevant SOPs, so the standard operating procedures that we've talked about in the past. They are responsible for that as well. So it's quite a large part of your manufacturing process is this quality assurance piece, and that quality assurance piece is overseen by the quality assurance person. So they are responsible really for the maintenance of all records, the receiving and approving of all raw materials, the reviewing of your master product list, and your master formulation records and batch records. So they are responsible for seeing if those ingredients are the correct ingredients that we've checked off. Yes, item, 62193, which might be shea butter. Yes, that is the correct item to be used in this formula. They're also the ones who will then review the process. Is the process correct? They will also be the ones to review the associated SOPs, which are the standard operating procedures, and initial their name there and date it to approve using, a certain product or creating a certain final product. They also check in on the labeling, the packaging, and the distribution to make sure that it is being directed to where it's meant to be directed, that the label is correct, that all of the proper nomenclature is relayed. So is it inky names that we're looking for? Is it botanical extracts and botanical names that we're looking for? And they are ultimately the end guy or girl before your product hits shelves. So in every step of the process, you need a QAP to review and approve all ingredients, all processes, as well as the final distribution. So let's talk about what that looks like for a small business. For a small business, when you are the person wearing all of the different hats of, the manufacturer, the packager, the labeler, the importer, and the distributor, then chances are you are that quality assurance person. So it's very important, though, that we don't cross over the lines of what the individual roles are. So when we're manufacturing, we are only manufacturing. We are only following the step-by-step processes as laid out. When you are not manufacturing, but when you are developing your master formula sheet for each product that you make, that's when your quality assurance person hat goes on. So that is when you go through the formula and you review all the ingredients and all the specs on it, all the processes on it to make it. You review the suppliers that you receive those materials from. And when you're doing that type of work, that really is the quality assurance piece. Now, you cannot be modifying and changing your master formulation record while you're actually formulating. It doesn't work that way. And if you start doing that and you start blurring the line between roles, it will catch up with you, because in order to change that master formulation list, technically speaking, you need a change order and you need somebody to sign off on that, which is the quality assurance person, not the person making the formula. So you can see how it gets really confusing at some points. Now, I'm quite sure that any of us who formulate, whether it be cosmetics or whether it be natural health products, I think it's pretty fair to assume that we at the moment, within a new company and building and growing, we are that quality assurance person. But we want to make sure that Health Canada sees us as an appropriate quality assurance person. They want to make sure that they see all of those records in that record keeping. They want to ensure that formulations aren't being changed on the fly while we're making them, or packaging is changed on the fly while we're packaging. They want to make sure that all of those things are in line, and that is for product safety and also for your own safety, because when you follow the guidelines as set forth, you really are protecting yourself and protecting your business from potential backlash if ever there is a supplier issue, if ever there is a client or a customer who has an issue with your product, if ever there's a recall for any number of purposes, whether it's a supplier error or a manufacturing error. Either way, if that quality assurance piece is covered correctly, then you have covered all your bases and everything is easy to track, record, and then obviously to take corrective plan of action and to do it in a very professional way that Health Canada will approve of, because we are following their guidelines, right? So that is a little bit about the quality assurance person. They really do bear a large amount of the responsibility in ensuring the suitability of each product prior to sale. And the regulation relating to quality assurance, it ensures that the necessary and relevant tests are carried out. There's checks and balances in place within your company, and that those are carried out so that products are not released for sale that should not be released for sale yet, or that there is a supply issue and it wasn't caught, or any of those types of things. We need to ensure the quality of our products, and the way we do this is through a very streamlined, direct approach, and that is through the quality assurance piece and the record keeping piece of the quality assurance. So that is really it for today. I'm going to chat a little bit about tomorrow. Tomorrow is going to be a little bit of a different day. I have an important appointment that I cannot miss, and it happens to be at 11 a.m. MST. I tried to reschedule it, but I'm meeting with people from 2 different countries, so it's not going to work out any other time just based on time change. So what I'm going to do is I'm going to pre-record my GMP Live feature for tomorrow. That's obviously not the goal. It's supposed to be a live feature so I can, respond to questions and chat with you guys as well throughout. But tomorrow's will be a recorded feature just based on the fact that there's no other way I can work around this appointment. So stay tuned for that. And I'm really, looking forward to sharing more with you guys about the good manufacturing practices and outlining your own good manufacturing practices. I've been getting lots of great questions on it, and I will be answering those all later this week. And aside from that, I hope you guys all have a fantastic Wednesday, and we will chat with you all tomorrow at 1 o'clock for sure in our Thursday Q&A. But definitely you guys will have your GMP video for tomorrow posted as well. So hope you're all having a great day. Drop me any questions in the comments, and I will be glad to address them in my Q&A Thursday. Have a good day, everyone. Bye for now.